Hi, welcome to Fast Intelligent Care. This is our part 2 episode with CEO and founder of Enable Lifecare, Ruben Joyce, and also one of the developers of the new pressure care mattress range, Elata, which we're very excited to introduce you. And we also will talk a little bit more about what Elata is, what's different, and some of the exciting things that are coming with Enable Lifecare, including our app. So how do you assist people or clinicians with choosing the right product?
Yeah, well, that's good, because a lot of the incumbent pressure care tools available, i.e. Waterloo, Braden, Norton scales, are from a clinical point of view. And we've found that the Purpose T tool was the best tool for us as a manufacturer of a device to use to help clinicians choose the right product. We've modified it ourselves and then implemented components of it into our app so that we can guide you from an entry point of having a person needing a mattress right through to the right product to choose. And that's through questions that we've found as a manufacturer and from the clinical aspect are both requirements to ensure you get the right product. Yep. So whilst we may not ask some questions you'd typically expect to be asked in a pressure care tool, we have taken the approach of keeping it as simple as possible and only focusing on the questions that are going to make a tangible difference in your choice of product, so that you're able to get to the right product with confidence the first time.
That's great, and that helps a lot with OTs having there's a lot of noise in terms of so many products out there, quite a lot of similarities, and you don't really know what puts one apart from the other, and end up focusing on maybe some individual features and then not really kind of losing sight of maybe what the goal is.
Yeah, so we try to take a lot of the smoke and mirrors out of mattresses and put that clarity to the therapist so they know with confidence and they can trust in our system to get the right product.
And can I ask what the vision or the goal is of Elata?
Our goal is 0 preventable pressure injuries. It's a high and lofty goal, which we need to have, because it means that we can focus on any product or any adaptation to a product and training that will deliver to that goal. So it gives us it's very broad in the sense that it gives us a lot of scope, whether it be in a new system or education or training or a new product. So that's why we've got that. It's quite a broad and quite a lofty goal.
It's a great goal to have, and it's interesting that we haven't been able to reach that already with all the technology that we have, but it's a great goal to have. And like we know, the pressure injuries can have such a big impact on not just the person with the injury, but also family members, the healthcare system, the clinicians have to deal with it as
absolutely.
Well. So the next question that I have is, I mentioned Elata being a system. Can you explain a little bit about what that means for Elata to be a system?
That's a good question, Chanelle. We see the system being not so much an individual product or a product being used with something else, but the system describes the range of product that we have, but the approach and the methodology and the clinical understanding that we take to delivering it as a complete product range, with the training, with the education, with the after-sales support, but also with the assessments and getting the assessments really fine-tuned so that it is a system. The system of Elata makes life simpler for clinicians, for carers, and for the client or the person themselves using the mattress. So that's where we stand out as different, where we make it easy not only in providing a product range, but we make it very easy to define when you should use which category of product within our range. So that's through our assessments, and then through the way we use the product, we simplify the options on the product, and then we even have what we're calling the clinician login on the pump. So if the pump needs to have a bespoke change for a patient or for a person, that is able to be facilitated, and it's within a framework so that there is safety. We're not allowing clinicians to log in and put end users in a compromising or an unsafe position. But it's so that things like increasing the standard pressure above what is already there, or maybe you're sensitive to light, so we can actually dim the LEDs on the panel, or maybe it's sound, we can reduce the sound of the notifications on the product. So different areas that we've perceived as potential for some users of the product, we're able to adjust them based on the clinician login.
Yes. And with the, I guess the design or let's say the design of Elata, did you have it in mind that it was going to go into hospitals, or what was the approach in terms of?
Our initial approach was to go community first.
Okay.
Enable focuses on delivering the best care to everybody. So we're not a hospital first focus. Our focus is the majority of people. And so that's where we've actually taken our design from looking at it as a medical device in a private house as number one, which actually means that we have taken our product to be tested to the 60601-11 rather than just the -1, which is the testing required for a hospital. We've taken it a step further to be -11 so that it's designed, it meets the requirements for medical devices in the home. So what that means is it's had to achieve a higher level of testing than what it would to go to a hospital.
And is that because we're looking at non-clinical carers?
Correct.
Predominantly when we're in the community.
There's a lot of factors that we can't take for granted in a private home that are taken for granted in a hospital environment. So that's why it needs the higher testing.
And is that also why things like the PowerGuard and SafeHold were added in for those cases where someone's maybe in a remote rural area where they do have power outages?
Yeah, so that's where SafeHold, PowerGuard are definitely the priorities for in someone's private home, where they may not have access to battery backup or uninterrupted power supply. They may not have someone living with them that is able to make the changes necessary to the mattress if there is a power failure in the middle of the night. So that's where we have automated all of those for the best outcome of our users.
And I think something that I really like about the pump is like the actual interface. Like it's very, like if you look at the buttons, it's very intuitive. I've seen a lot of pumps where it's a bit complicated to understand what button is which one, and that's I guess where the safety comes in, where you can accidentally change the settings incorrectly, or someone might actually think they're doing a good thing to make it more comfortable, but like you said, it needs to default to the safety.
Yeah, those icons took a long time to develop, and we actually tested it on a number of people to ensure that someone with no education or no previous exposure to the device could immediately assess what the most likely outcome of that button was. And it was great fun actually testing it out, looking at different icons and making sure that what we had was universally accepted and wasn't going to lead to confusion. But at the same time, we're really wanting to make sure that the settings that a clinician sets up for a patient or a person using the mattress are not changed by someone that doesn't understand what's being done.
Yeah.
And so that's where a lot of the settings, we've allowed a lot of the settings to be locked in place through the clinician login, if that is required for that situation.
So does that mean with the clinician login, it has to be someone that has clinical training or some type of clinical background to be able to access that? So it's not just any person that can.
No.
Yeah. Thank you. That was our part 2 of our Fast Intelligent Care episode with Ruben Joyce, the CEO and founder of Enable Lifecare, and our talk about Elata. We'd love to hear from you in the comments if you have any feedback, any stories that you would like to share with us. Like, subscribe, and also for any more information on pressure care or for any tools, whether it's risk assessment tools or mattress selector assessments, please go onto our app.